So I've got Ivy needed here, and her orders indicate that she needs extra fluids and antibiotics. So I'm gonna start an IV of normal saline, 1,000 milliliters, to be given over 6 hours. Here are my orders and my dosage calculations on there. I have labeled the fluid with her name, the date it's hung, the dosage, start and completion time. And I would normally do that after, but to save time in the video, I just got that done. So I'm going to put on a tourniquet and locate the vein that I want to use. And I think I'll use this one. So I'll take off the tourniquet, clean the site. Cleaning from inside out. One more. Okay, Ivy, the doctor wants you to have some extra fluid because you're dehydrated and you have an infection, so we're gonna also be giving you some medication here for that also later. Could you give me your name and date of birth, please? Okay, perfect, we got the right person. Hand hygiene, washed my hands. Gonna go ahead and put on gloves. My site's clean and drying. Open my medication set. I guess I should need to do my gloves till after that. Close my roller clamp. Move that up a little bit. Take off my normal saline, which I have checked the orders to make sure that IV needed is the one that needs 1,000 milliliters of 0.9% IV. So I've got the right patient, the right medication, the right dose. It's to be started now, the right time. Documentation will go on my MAR and the patient record. Do I have everything? Right medication, right patient, right dose, right route, IV, right time, documentation. Yes, okay. All right. So I'm taking off my cover. And my cover, and I'm getting my line stuck in. Gonna squeeze to fill 1/3 to 1/2 full in my chamber. Find the end of my line. And I'm gonna find my roller clamp. Put that down so it's clean. And we're gonna get this running at a little bit slower rate. Get the air bubbles out. All right. recover this so I can get the holes out of the bubbles out of the line. Moving a little bit slowly, but they're going. Here we go, into the chamber. Okay, got my line all ready to go. Opened my cover. Get my needle open. And my lure lock. Which I'm going to connect to my V-line. A little bit more fluid through there to prime that. And I'm going to place this in my needle container so it remains sterile. Okay. Now, I'm going to put my tourniquet back on. Check the radial pulse, make sure it's not too tight and it's good. And my vein looks good. So my bevel is face up. And I'm going to be watching for flashback. Which I don't have, so I must have gone through. Vein is moving. Okay, this is not a good sight. That's gonna, so I'm gonna recap my needle. I'm gonna clean another site. Take off the tourniquet. All right, so my needle went into the sharps container. I got a new needle. I got my tourniquet back on. I got my bevel face up, pulling back on the skin. Oh, and here's a little flashback. I forgot to open my vein here. Here it is. So I'm pushing it in. My gloves are slippery, so they don't do very well with the catheters. Holding the catheter in, pulling the needle out. Connecting my lure lock. Okay, that's going in the sharps container. Okay. Clean this off a bit. Okay, I'm gonna put a 2x2 under here. Just to hold it in a good position. Okay, now Ivy, in order for this to remain patent, that means that it's gonna continue to flow easily. It's best if you don't move your arm much. Just rest is absolutely necessary, but really try to keep it as trying to hold my ivy still, keep my gauze out of the way. Okay. So if you do that, if you hold your arm still, it'll keep your vessel from coming back onto your needle, onto the catheter and closing it off. So that'll help a lot. Okay, anchoring it with the chevron. I'm gonna put a clean 2x2 under here. Okay, so then I'm gonna label this with today's date, my initials, and the time is 1400. Let me take my glove off. There we go. All right, now I've got my site ready to go. I'm gonna secure it with some more tape here. And then I'm gonna wrap it up like this and secure this up here. Not on that. How am I gonna do this? Maybe I need shorter tape. Do it right here. Okay. So there's no infusion. There's no, take off the tourniquet. No edema present. No reaction at the site. So it's looking good. My drip rate is 28 drips per minute divided by 4 is 7. So I need to have 7 drops in 15 seconds. And of course I forgot to put my watch on. Okay. So it's sharps. And then I'm going to label this line. I've got my sticker ready for today's date and the time of administration with my initials on it. Okay, so Ivy, this is helping with your fluids, and I'm going to come back in a little bit and we're going to give you an antibiotic for your pneumonia. So I'll be right back. Okay.